Hello. Audible?
Back audible. I'm visible, right? It's audible, Ra. Am I audible?
Yeah, you are audible now.
Yeah.
So let's begin now. A very good evening, everyone. This is Arunagiri, director of Prisag Games Tamil Nadu, and it's my immense pleasure to welcome all you tonight. On behalf of our entire team and the Games and Prisag, thank you for joining us and what I believe is one of the most crucial conversations we have as a students and the young professionals. We have been there juggling deadlines, preparing for exams, and pushing our limits in this relentlessness pursuit of excellence. We often wear our stress as a bandage of honor and treat sleep as a luxury we cannot afford. We push
Arun, your audio is not clear.
our minds and bodies to risk
Dr. Arun, your voice is not audible.
Hello.
Yeah, you're audible now.
Yeah. This is precisely what we are here to explore in our webinar, Sleep Stress and the Student Brain, an Underestimated Triad. To eliminate this path for us, we are incredibly honored to have a speaker who bridges the world of clinical psychiatric experience with a genuine understanding of students' life. It is my profound honor to introduce Dr. Raghunandan Ramanathan. Dr. Raghunandan's profile Dr. Raghunandan's profile is a testament to what it means to be a modern medicine leader, and is a distinguished psychiatric resident at a renowned Amrita Institute of Medical Sciences in Kochi, where he is deeply involved in clinical sciences of mental well-being. He's a visionary innovator and a leader. It gives me immense pride to share that he is the founder of Medicine Inc. and showcasing his incredible entrepreneurial spirit and his drive to build and create healthcare space. And also, Dr. Raghunandan is the previous past president, past co-convener of IMA MSN Tamil Nadu and national council member of IMA JD in Tamil Nadu and former national joint secretary academics of IMA MSN headquarters and a recipient of Champions of Champions Award, Listener Metropolis, and recipient of National President Appreciation Award for Medical Internet and three consecutive awardee of a State President Appreciation Award of IMA MSN Tamil Nadu. And we are incredibly grateful to have you, sir. And over to you.
Thank you, Arun. Thank you for such a wonderful and opportunity given for me to address the students and the members of the Global Association of Indian Medical Students. Thank you for inviting me today. It's a pleasure to be with you all today, fellow medical minds in training, trained to balance your learning, performance, and sanity. Let me start with a quick show of hand. or just a moment of honesty. How many of you slept less than 6 hours last night? Can you put in the chat box? Less than 6 hours last night. How many of you slept? Come on, I just want an interactive session before introducing me. Before introducing this session, I just want you guys to put in the chat box how many of you have slept less than 6 hours. Okay, I got two of them, three, and I can also raise my hand, definitely. Apart from me and others, yeah. So I think majority of you, we guys are sleeping less than what is prescribed or what we study actually. uh, did you stay up late yesterday studying, or doom scrolling your Instagram under the covers, or telling yourself just one more reel, just one more game, and you just going to like stay awake all the night? How many of you did that yesterday? Did you study, or did you scroll your Instagram, or did you watch movies, and what all you did? Come on, put in the chat box. Game, very good. Arjun, honestly telling it as game. Lalita, Insta and movies. Others, series. Wow, Arun is involved in research. Okay, Arun, appreciation. But I think majority of us, including me, including everyone, go into game, go into movie, go into series and whatnot. So this session today is not just going to be an academic session, but an interactive, a self-introspective session on what we are doing and what we have to do and what we shouldn't. If that sounds familiar, that every one of you are awake, then you are not just alone. In fact, you are a global pattern, one where sleep is sacrificed, stress is normalized, and we are left to cope up in our survival mode. Today's topic: sleep, stress, and students' brain. A triad that dives into a exact problem. It is about the hidden but powerful connection between how we live, how we manage stress, and how our brains perform under pressure. But why this topic? When Arun asked me to give a powerful topic, to give a suggestion for a powerful topic, we both decided this: sleep, stress, and student brain, the underestimated triad. Why? It is about the hidden but a powerful connection between how we sleep, how we manage our stress, and how our brains perform under pressure. Because the very system we are trying to train our brain is also the one we are unknowingly exhausting. Sleep isn't just rest. It is when memory consolidates, it is when the neuron regenerate, and when the emotions are being processed. Stress, on the other hand, isn't always bad. When you are just 10 days, 15 days prior to your exam, that stress gives you adrenaline rush to complete your portions, isn't it? But when it is going to become a chronic, it can literally shrink the parts of your brain responsible for memory and reasoning. And when you combine the two, poor sleep and high stress, when you're going to combine these two, you create a perfect storm for a burnout, a perfect storm for anxiety, a perfect storm for a memory impairment. And this is going to affect your academic performance, and it is going to definitely give a long-term health consequences. But here is a good news. This cycle isn't inevitable. When you, a doctor, a striving medical student, a resident, understand the biology and psychology behind this triad, you can help not only to survive in the medical school, but you can thrive into it. Today, we are going to explore how your circadian rhythm is being hijacked by your screen time, by your academic deadlines, and all the sort of things which we are dealing with on everyday basis. We will talk about the stress as a neurochemical phenomena, not just a feeling. We are going to examine insomnia in this session from a clinical and a cognitive perspective, a behavioral lens. And we will close with a practical, evidence based strategy for sleep hygiene and resilience tools you can use tonight. This session is not just academic, this is going to be your personal, but adding on to a bit of academic, because without academics, listening just to the stories is not going to benefit you. You are not a common person, a common public, but you are a medical student. So something has to be useful for you. So that is why I made a combination of both academic perspective, where All these questions, all these topics can be asked even in your exam. So you will be able to write your questions in your exam, as well as we are going to examine the practical things, what you can do and improve yourself. Because no matter how many facts we memorize or procedures we learn, only when we memorize it, only when the brain allows it to stay, then only it is going to help you out. For that, your brain needs a rest, it needs a recovery, it needs a regulation. So let's get into the story. Let's get into this strategies and understand the underestimated triad and start taking our sleep and stress seriously. So let me begin with, I think, humble introduction given by Arunagiri already. So I have been in this medical education, interacting with the people, starting from my senior batches, I have interacted to the super junior batches. That is up to 2024. I have been in a regular connection. I have been talking with them, and some points I have understood from them. With this, I am going to tell you some strategies. So I will definitely promise you that it is not going to be just advices. Rather, it should be a scientific, it should be a rational steps that can we can take in order to improvise ourselves. So by the end of this session, students, those who are listening here, should able to understand the role of circadian rhythm in understanding the sleep regulation. Sir, why should I understand the circadian rhythm? First of all, you will be getting questions in your NEET PG exam, so I am giving importance to it. Second thing, to understand why, what, and how. Whatever we give advices. So I can simply tell you and go today that you need to sleep for 6 hours. But why you need to sleep for 6 hours? Or what is there behind that? For that, you need to understand the circadian rhythm. Next, explain how academic stresses are going to impact your sleep and your brain function. What happens really? You need to understand. And then you need to recognize the clinical condition, clinical features that is going to happen because of you delaying your sleep, because of you sacrificing your sleep, and then apply the basic sleep hygiene principle to improve your well-being and your performance in any exams. So this session is not going to be basically helping you not just for your exam improvement. So it is going to help you for your performance, not just in your exam, but in your life per se. So life does not revolve just around your exams, isn't it? So life is going to be a very broader one for the every single action you do. So for even, so let's take not just your academics, a relationship. For having a good relationship, you need to have a good mood, isn't it? For having a good mood, you need to have a good sleep. How it is connected? Our mood and the sleep connected? That's exactly what we are going to discuss today. So, what is a sleep basically? Sleep is nothing but a recurring reversible neurobiological state, which is going to be perceptual disengagement. What is this perceptual disengagement? Perceptual disengagement is going to be from response from your environment, response from your surroundings, etc. So, you are going to be completely disengaged from your environment, but a reversible one. If it is going to go into an irreversible one, then you're going to move into coma, but you're going to be a reversible, recurring neurobiological behavior. Okay. And this is going to typically accompany by postural recumbency, a behavioral quiescence, and a closed eye. That is how a human sleeps, isn't it? So a dog usually sleeps by keeping their eyes open, but humans closes their eye. We have some posture which we follow, and we have some behavior. That's exactly what sleep is defined as. So I think many of you answered how many hours you guys sleep. So many people slept less than 6 hours, including me. I am not excluding me. So I want to introduce this triad: sleep, stress, and brain function. So all three are interconnected to each other. They are not just the lifestyle as we all see. So as a common public, we see as a lifestyle, isn't it? But it is not lifestyle. It is something which deals with neurobiology and psychiatry, which every medical student should understand. Then, when, for example, your maybe your relative, your cousin, your friends, or from a non-medical perspective, they may come to you. They may ask you, "Macha, I couldn't sleep in the night." Or sometimes they will be telling, "I am always feeling tired." Some people will tell, "I am having a night shift, so I couldn't concentrate in so many aspects in my life." So all this are going to revolve around these three things that we are going to deal with today. Okay, so first thing, why do we sleep? Can you guys put in the chat box? Let me see. What is your understanding? Why do we sleep? So I want this question to be answered. Why should we sleep? What happens when we doesn't sleep? Arun is telling for rest. Okay, fine. Others, come on. Why should I sleep basically? Yesterday I didn't sleep. I am able to talk to you today. Then what is going to happen to me? For giving brain some rest. Okay. Why should, next question, why should I give brain a rest? If we doesn't sleep, we can't be fully efficient. Okay. What do you mean by efficiency? So my next question goes to Arun is, what do you mean by efficiency? So if I don't sleep, I will not be fully efficient. What is efficiency here? What is efficiency here? What do you want? My whole day will be slow. Okay. Okay, fine. Why? Why your whole day is slow? Okay. So let me begin with, let's start with a system we rarely think about that influences every biological function. That is going to be your circadian rhythm. So circadian rhythm is something which is present in our body. It is like an internal clock that is going to run a 24-hour cycle. Okay. But before moving into circadian rhythm, I want you to understand this. Okay. Why do we sleep? So sleep is basically regulated by two processes. I call it as process S and I call the other one as process C. Okay. One I call it as process S and other I call it as process C. What is this process S and process C? Okay, process S is nothing but it is a homeostatic process. So this process regulates your sleep pressure. So there is something called a sleep pressure. Okay, so imagine when you are not sleeping an entire day, probably interns, if anyone here, if you're not going to sleep the entire day, you have a tough case in your unit, you have a very tough ER where you're going to do a ER duty and you couldn't able to sleep that night. Next day, after somewhat around 12 o'clock and 1 o'clock at the noon, what happens is slowly your eyes starts to pressurize to close itself. Have you ever witnessed it? So your eyes automatically gets closed. Why? Because there is a homeostatic process where it regulates the sleep pressure. It pressures you to sleep based on the previous wakefulness, based on the previous experiences, based on how many hours you have been without sleep in the previous days. So that is called as homeostatic process. Next comes the circadian process. What is circadian process? This process is going to follow a regular rhythm based on the light dark cycle. Based on light dark cycle. So it is not all alone your day night cycle that influences your sleep. Both your homeostatic process and circadian process both are going to work together to regulate your sleep pressure and timing and determine when you should feel sleepy and when you should feel awake. This is an entire neurobiology which you need to understand. It is not just all the night time you are sleeping, daytime you need to be awake. It is not just that is one which influences your sleep. There is both your homeostatic process based on your previous experiences along with your circadian process. That is why in a people who are working in a night shift, they are not sleeping at the night, isn't it? They are sleeping only in the morning. How it is possible? If only your circadian rhythm is going to influence your sleep-wake cycle. That means you have your homeostatic process along with circadian process, which involves in your sleep-wake cycle. So now first question is, why do we sleep? I asked you. Now can you tell me how do we sleep? How do we sleep? Can someone put in the chat box? Why do we sleep? I told you there are two processes, homeostatic process and circadian process. Now my next question comes is, how do we sleep? Anyone? By closing our eyes. Excellent. That's a wonderful answer. Seriously, I'll tell you why. Others? Others, come on. Let's keep this interactive because it's such a boring session. I don't want to advise you. I wanted to educate you, basically. Why do we sleep, you all guys told? How do you sleep? By over-exhausting. Arun researches, right? So after reading of 10 to 15 article, you automatically get sleep. Others? Others, guys? Okay. So I'll tell you. So the same homeostatic process and you have your circadian process, right? So this is something that makes you to sleep. These two together makes you to sleep. How do this happen? I'll tell you. This process regulates your sleep pressure. I told you, right? Which process regulates your sleep pressure? Can you put in the chat box? I told you two things. I told you two things. One is your sleep pressure, and second is going to be your day-night cycle. Okay, day-night cycle or dark light cycle. Okay, can you tell me which is the one that is going to involve in the sleep pressure? Which process involves in the sleep pressure? Whether it is a process yes or process C? Whether it is process yes or process C? Come on, guys. Come on. You're going to explain this tomorrow to your friends, and your friends will think like you have some intellectually you're talking, but it is not intellectual. It's a neurobiology which everyone should learn. Process, yes, yes. So it's a process, yes, or homeostatic process where it is going to regulate your sleep pressure. And this sleep pressure is going to influence, this sleep pressure is going to influence something called as adenosine in your brain. Okay, you all would have heard this molecule, right? Adenosine. This adenosine is going to be the one which influences your sleep pressure. So sleep pressure increases when you are going to stay awake. As long as you stay awake, as long as you stay awake, your adenosine is going to get accumulated. As the adenosine is going to get accumulated, what happens? It in turn increases your sleep pressure. So what you can do is, whenever you're going to be posted in a ER duty, you wanted to be awake for 12 hours straight, non-stop, without sleeping. Or sometime if you're going to have a 24 hours duty as a resident, what you can do is in between, you can take a nap. What is the advantage? In between, when you're going to take a nap, okay, your adenosine accumulation is going to reduce. When your adenosine accumulation is going to reduce, automatically your sleep pressure is going to be reduced. When your sleep pressure is going to reduce, that makes you less sleepy. Okay, so now I have told you one technique in the middle. Scientifically, rationally, I'm telling, when you're taking a nap, that reduces the sleep pressure by reducing the accumulation of adenosine. This is a technique number one. Now coming towards your circadian process. This process follows a regular rhythm related to a light-dark cycle, typically aligning with your 24-hour duty. So this is exactly what we call it as a circadian process. So this is what we call it as a circadian process. So in order to understand the circadian process, you need to understand that your circadian process is a body's internal clock that is going to run 24 into 7. And this is going to control a group of neurons called as suprachiasmatic nucleus. So this day-night cycle is going to involve, and it is going to actually control a group of neurons called as suprachiasmatic nucleus. This suprachiasmatic nucleus is present in the hypothalamus. Basically, it is going to be present in the hypothalamus. And this responds to the light and darkness in our environment to regulate the physiological process of your sleep, body temperature, and hormone secretion. Clear, right? Any doubts in this? So you have something called a suprachiasmatic nucleus, which is going to be present in the hypothalamus, and that is going to involve in the sleep cycle. Okay, so that is going to involve in the sleep cycle. So what happens basically, how these two are interconnected. So whenever you're going to have an increase in the sleep pressure, whenever you're going to have increase in the sleep pressure, that is going to favor your circadian rhythm. It is going to favor your circadian rhythm. Okay, and that is going to cause sleep. And conversely, even when there is going to be a decrease in the sleep pressure, when there is going to be decrease in the sleep pressure, and when your circadian rhythm is going to promote wakefulness, okay, wakefulness, we are going to be awake. So this is the simple thing which happens. Okay, if a person doesn't sleep for a day, for example, yesterday I haven't slept properly because of my duty. So my circadian rhythm continues its regular pattern regardless of sleep deprivation. Okay, my circadian rhythm will continue. It does not going to have any effect. But what happens is my sleep pressure keeps on increasing. Many people think that circadian rhythm is the one that is going to cause sleep. No. Sleep pressure is going to raise, and potentially it leads to a micro sleeps or dozing off during the day by inhibiting your circadian rhythm, by influencing your circadian rhythm. So even though a person is going to be having a circadian rhythm where actually daytime he should be awake and nighttime he should sleep, but when the sleep pressure increases, it can potentially cause you to doze off even during the day. So this is what happens during the accidents. So when you are going to be taking a duty, when you're going to do a ER shift, when you're going to be doing a 24-hour shift, and at the evening of the next day, that is going to make you 36 hours. And when you're going to take your bike, when you're going to ride, what happens? This sleep pressure is going to be at the peak. And when the sleep pressure is going to be at the peak, and it can cause a impaired alertness and cognitive function. So whenever there is going to be rise in the sleep pressure, what happens is it is going to cause impairment. It is going to cause impairment in the alertness. It is going to cause impairment in the alertness. Okay, it is going to cause impairment in the alertness, and it is going to cause impairment in the cognitive function. So left indicator போட்டு ரைட்ல போவீங்க. என்ன ரீசன்? நீங்க உங்க மைண்ட் லெஃப்ட்ல போக சொல்லும், but your cognitive function is impaired, so you couldn't able to take a decision. But why this happens? Why this homeostatic process happens? How this sleep pressure is going to get influenced? That's exactly what I'm going to discuss next. I'm sorry, Arun, I have given 1 hour time, but I think we have started late. So my timing is also going to extend around 8:15. So just pardon me, guys, just
Yeah, it's
pardon.
okay now. It's okay now.
Okay, so what happens is homeostatic mechanism, what exactly happens is there is some flip-flop switch for arousal and sleep in our body. So what exactly happens? We have something called as ventrolateral preoptic area. So this is going to be your ventrolateral preoptic area. It is going to have a group of neurons. And this group of neurons is something that is going to promote your sleep. And in the opposite side, you have something called as ARAS. This I think many people would have read. Okay, ascending reticular activating system. Ascending reticular activating system, which is present in your thalamus, which is going to relay. Okay, this will be promoting a way awakening. So this will be promoting awakening. So one will be promoting sleepiness, one will be promoting awakening. So when there is going to be awakening, so when in the daytime, I'm not going to sleep, isn't it? I'm going to work. What happens? What makes me not to sleep during the day? That you need to understand. That's where you have another one called as orexin. It's it is from the posterior lateral hypothalamus, and that will also promote the wakefulness or awakeness. So what happens is during the awakening period, so we are awakened, right? We are not sleeping now, right? So when we are not sleeping, what happens exactly is your orexin is going to be stimulated. When your orexin is going to be there, that orexin is going to come and stimulate your anterior reticular, your ascending reticular activating system. When the orexin stimulates your ascending reticular activating system, that is in turn going to inhibit your ventrolateral posterior or preoptic area, ventrolateral preoptic area. So when this is going to inhibit the ventrolateral preoptic area, what exactly happens? What exactly happens? Your ventrolateral preoptic neurons are going to get inhibited, and your thalamic area, ARAS, is going to get stimulated. And because of all these things, you remain awake in the day. Clear, right? But when there is going to be a sleepiness, so when we are going to sleep, when we are going to start sleeping, what exactly happens is there is going to be a flip-flop switch. There is going to be a switch in this condition where your VLPO is going to become dominant. Your orexin is going to be less, your orexin amount is going to be less in the system. So when the orexin becomes less, your VLPO gets activated. Your VLPO in turn inhibits both your orexin stimulation as well as your ARAS, that is ascending reticular activating system. There's another one which stimulates your VLPO, that is going to be your circadian rhythm. At night, your circadian rhythm is going to get stimulated by the activation of VLPO. Same way, when you're going to have increase in the sleep pressure, when you're going to have increase in the sleep pressure, or when you're going to have your nighttime or darkness, nighttime, or when there is going to be darkness, what happens is it is going to cause stimulation of your VLPO. Okay, ventrolateral preoptic area is going to get stimulated, and because of that, you are going to have inhibition of the ARAS and your orexin. ARAS as well as orexin, when both are going to get stimulated, automatically you guys sleep. Now, can you understand why you guys are sleeping? Because of your orexin, because of your ARAS, because of your ventrolateral preoptic area, you are basically sleeping and awakening. So whether it does directly its action, When the ARES is stimulated, whether it is going to directly work? No. There are some important neurotransmitters that are actually causing this, all this kind of important sleep wake regulation. Okay, so you need to understand that. So there is something called as serotonin, noradrenaline, histamine. All the serotonin, noradrenaline, histamine are going to be very high when the patient is awake. Similarly, all your acetylcholine, okay, your dopamine, your glutamate, all these things are going to be more in the awakening period. Similarly, orexin is going to be more when you're going to be awake. But what happens in your NREM and in your REM sleep? I'll come to what is the difference between both. But in your NREM and REM sleep, what happens? Your serotonin, noradrenaline, histamine is going to be low. But ultava, in your REM sleep, what happens is your acetylcholine, dopamine, glutamate, all these things will be very high. Okay, acetylcholine, dopamine, glutamate will be very high. That is the reason why you are going to get restless. You are going to REM is going to be very active period of your sleep, isn't it? So that is the reason why you are getting an active period. Is it clear? Is it understandable? Do you guys understand what I am talking? Is it making sense? Can you guys put in the chat
Yeah,
box?
yeah.
Okay, so you need to understand that your NREM sleep, basically, it's going to be a cycle. Okay, you're going to have a NREM sleep, then you're going to have a REM sleep. So in that, you need to understand, okay, first when you're going to be awake. So first stage is going to be awake. Then slowly what happens whenever your sleep pressure is going to be raised because you're not sleeping. What happens? You're going to become drowsy. You're going to become drowsy. Then what happens is you're going to enter into the stage one. You're going to enter into the stage one. In the stage one, it is going to be a stage between a wakefulness and a sleep. You don't go completely into sleep, but you will be in a middle period. Okay, then what happens? You move into the stage two, where your heart rate is going to get less and your brain does less complicated works, but still your brain does work, but it is going to be less complicated work. Okay, then you're going to move into the stage three, where all the hormones are going to get released and the body makes repair. So your body is going to make repair during those periods. Those periods, your body is going to make a repair, and you're going to get all the inflammatory markers, all the anti-inflammatory markers are going to rise. All your inflammation gets solved during those periods. Then coming to the last stage, that is going to be your stage 4. Okay, where what happens is there is going to be a blood flow directed towards the muscles, and that is going to restore your physical energy. So in the moon sleep we call it as a NREM. We call it as NREM sleep. We call it as NREM sleep. So in the NREM sleep இருக்குல்ல, இது வந்து பாத்தீங்கன்னா, it is the time when your brain is going to get relaxed. But suddenly, after this stage, it is going to enter into the fifth stage, where there is going to be just entirely opposite of your NREM sleep, where your heart rate is going to rise, where your temperature is going to rise, when your brain becomes very active, when the dreams goes very vivid, when your dream goes very vivid, very horror kind of things. You suddenly wake up from your dream, isn't it? So those things are REM sleep. Here you're going to have a fast, rapid activity of your brain. Okay, so this is exactly what you call it as a sleep stages. So how do we understand the sleep stages? So to understand the sleep stages, we started to do EEG. Okay, electroencephalogram, where we detect each and every sleep stage based on the rhythmic waves that we are going to get in the EEG. Okay, in a stage one, what happens just when the pressure is going to rise? You will be having a drowsiness. That is the stage where you have something called as alpha waves. That is the time when you have something called as alpha waves. Then comes the stage 2. From the stage 2, what happens? In between the stage 1 and stage 2, I wanted to keep it. So here you going to have something called as theta waves. Okay, you have something called as theta waves, where in your drowsy or alpha waves, you cannot actually visualize. It is going to be like this. This is your alpha waves. Suddenly, after your alpha waves, you're going to have something or sharp kind of things is going to come. Okay, this is called as your theta waves. This is going to be called as theta waves. Now, after theta waves, what happens? You will start to get some sleep spindles. So can you see here? So this is called as your sleep spindles. Okay, after you get a sleep spindles, that is going to be present in your stage 2 of your NREM sleep. Okay, this is your light sleep. And then comes your third one, where you're going to have a third stage where you're going to have delta waves. In this delta waves, can you see the difference between the two graph is going to be like increasing. The wavelength is going to increase. So this is called as your delta waves. And finally, your REM sleep. Finally, it's going to be REM sleep where it is going to be like this. Okay, it is going to be like this. This is called as your REM sleep. This is called as your REM sleep. And you need to understand while waking or eye closed also you will have alpha waves and beta waves you will be seeing when the fully awakened person, when there is going to be eye open, you call it as a beta waves. Is it clear? So are you guys clear about the different, how do you understand, how do you get to know about the different waves and all? Is it clear, right? Till
Yes,
now, do you have any doubt? Anyone? Any doubt? So this is again a very important question in your NEET PG. That is why I added this in my session. Though my session is not fully academic, I wanted to just insert bits and pieces of NEET PG exam, which everyone are like thriving to write, isn't it? So I want you guys to learn this. Okay. So to begin with, about the circadian system. The earth is going to have 24 hours axial rotation, right? So this forces all the organism whichever evolved in this earth to adapt to the dramatic recurring cycles of your day and night. So this 24-hour physiological rhythm that is going to synchronize with your external body is going to get synchronized with your external environment. Thus, it is going to meet the physiological demands of the body. So your circadian rhythm, circadian timing system is going to provide a temporal organization for most neurobiological behaviors, physiological behaviors, psychological behaviors, biochemical variables, including your sleep cycle. That is the reason why I call it as a master clock. But for this master clock, there is something called as melatonin, a key hormone which increases in the evening, makes us feel sleepy. So when in case next time when you're going to be posted in some unit and you're going to take a evening rounds, and during the evening rounds when your PG or your SR ask you why you are feeling sleepy, tell them that it is not me who is sleepy, but my melatonin which is getting increasingly secreted makes me to feel sleep. So that is exact reason. So when your melatonin decreases, your sleep decreases. When your melatonin increases, your sleep increases. Why this happens? Which is going to influence your melatonin? Why in the darker places melatonin increases, in a lighter places melatonin decreases? Because the production of melatonin is directly suppressed by the light, especially your blue light. Remember, guys. So here I'm just bringing in another new concept. Okay, blue light. Okay, blue light is something that is going to suppress your melatonin. Suppress melatonin. Now, can you understand why all the people in the internet, when people give you advices, don't use phone at night, don't use phone at night, why they are telling you? Because the blue light that is emitted from the phone, tablets, laptop is going to suppress your production of melatonin, suppresses the production of melatonin. Okay, so is going to be it is going, melatonin is directly involved here. Melatonin is directly involved here. So when the melatonin is going to decrease, what happens? You feel sleepy, you go to your bed, you watch Instagram reels, you watch series, you watch movies, and you see research articles like Arun. When you're going to see it in the in your tablet or in your laptop, if you're going to take print and see, fine. But when you're going to see it in the laptop, what happens is your melatonin is going to slowly decrease. Okay, now here's where things gets more interesting to students. During your adolescence and young adulthood, your age group, there is a natural phase delay in your circadian rhythm. This means that your melatonin secretion starts later at night. Okay, usually itself your melatonin secretion starts later at night because God knows that you are in the adolescent young adulthood period where you need to be energetic, isn't it? You have many things to achieve in your life. When you need many things to achieve in your life, you need more time. You need to spend less time for your sleep. That is why there is a natural phase delay in the circadian rhythm. This means melatonin secretion starts very late at night and your biological preference shifts towards going to bed late and waking up late. So hereafter, if your mother asks you why you are sleeping very late at night and why you are sleeping very late at morning, you are not waking up at the morning, you are going to sleep early. Then tell them that my body is accustomed, my body is manufactured like that because most of the time in adolescence and young adulthood, this natural phase gives you extra time to explore. Unfortunately, most academic schedules which are being done in our country is not designed for the young adult brain. Early morning classes, early morning hospital duty, late night studying, all these are going to be conflicting with your natural delay. And this results in the phenomena known as social jet lag. You all would have heard this word jet lag when you travel from a one hemisphere to the opposite hemisphere, or when you're going to travel from one western countries to eastern countries, when you're going to have a time lag because of the external clock, there you get a jet lag. And internal clock, that is your circadian rhythm, when there is a chronic mismatch, then that leads to a social jet lag. This mismatch leads to sleep restriction, often 5 to 6 hours of sleep on weekdays, followed by overcompensation on weekend. Have you noticed? Weekdays like you sleep like very less, and weekend like you will be sleeping like Kumbhakarna. Why? This inconsistent pattern is the one that disrupts your sleep architecture and impairs overall sleep quality. Though I am telling you today, that doesn't mean I am following anything in this because, as I told you, our system is not considering about the young minds or young brains which are designed like this. From a psychiatric perspective, this puts students at the risk of circadian rhythm sleep wake disorders, especially delayed sleep wake disorder, which is listed in your DSM 5. This isn't just staying up late. Remember, guys, this isn't just staying up late. It is a pathological pattern with daytime impairment. The effect of this circadian disruption are wide reaching. It is going to cause an impaired cognitive performance, reduced memory consolidation, emotional lability is going to occur. Okay, and increased risk of depression, anxiety, and more chances that you guys are going to end up in my clinic. There is also evidence linking that circadian mismanagement, misalignment is going to lead to a metabolic issues. It can cause an immune dysregulation. So, in short, when your sleep schedule is out of sync, when your body clock is out of sync, your brain suffers both academically and emotionally. Okay, this is exactly what I have already told. I am not going in depth of sleep cycle as time is constrained and it is not my exact topic also. But then you need to understand that your environment, your circadian rhythm, your peripheral systems, all are interconnected to each other. So you cannot just tell that your sleep is going to affect one part. It is going to affect your brain. It's going to affect your anxiety. It's going to affect your environment. No, it is going to affect every tissue. It is going to be like a stress to your body. It is going to be like a stress that causes inflammation in every cell of your body that you need to understand. So this, I think, this is too much for you to go into this session, but then this is entirely what we call it as a circadian rhythm. So all your leptin, ghrelin, and all these things which actually controls your sleep and wake cycle. So do you consider the current sleep habits of yours as healthy? Can you guys tell me? Can you guys tell me? Do you guys think after listening to me for the past 15, 20 minutes, do you think that whatever we are doing right now is healthy to our brain? Is it healthy to our brain? No, right? How? Why it is not healthy to our brain? That is exactly what I'm going to tell you now again. The physiological problems that you are prone to face, my dear friends, you're going to face tomorrow. What are the problem you're going to face? You need to understand that, right? So you're going to face all these problems tomorrow, and it is going to affect your entire process. And that's exactly what I'm going to tell you right now. Okay, so during your NREM sleep and your tonic REM sleep, there is a relative increase in the parasympathetic activity. Why? I told you, right? Acetylcholine is going to get increased. And your acetylcholine gets increased, your autonomic nervous system reaches its maximum, most stable state. And this is going to be causing a regulation in your blood pressure, regulation in your heart rate, regulation in your respiratory rate. All these are going to maintain a homeostasis in your body. Okay, but what happens when you are not going to take care of your sleep? Your ghrelin, okay, so what happens? Your ghrelin is going to get increased. Your leptin is going to get decreased. You're going to have your peptide Y, which is going to get decreased. So because of your sleep deprivation, you're going to have a resting metabolic rate is going to drastically reduce, drastically reduce. And when it is going to get drastically reduced, what happens? You take more time to eat. Have you ever wondered when you are very sleepy, you take more time to eat? It is not that you are lazy, guys. Remember, your resting metabolic rate is going to get affected. Because of that, you're going to take more time to eat. And because of that, the desire for energy dense foods is going to increase. That is why you crave for junk food. My dear, listen, when you have a partial sleep deprivation, when your sleep is not proper, you take more junk food. And your mother, your teachers tells you that you take more junk food, it is not good for your health. Why you take more junk food? Because your sleep is not good. You're automatically prone to take energy dense foods, and all these are going to get increased. And when your energy intake is going to get increased, automatically what happened? You are not spending your energy because you're fatigued, because you have your sleep deprivation, your fatigue, and you all your sedentary lifestyle is going to get activated. Your resting metabolic rate is again decreased, and all these causes energy expenditure very low. And when you have a less energy spent, and when you have more energy intake, what happened? Everything gets converted into a fat mass. And that is the reason when you are going to deprive your sleep, automatically you're going to get obese, you're going to get fat. And this is ultimately going to alter your glucose metabolism, raise your fat storage, and it is going to give you a insulin insensitivity, and you're going to end up with diabetic mellitus. So now you can understand, just a sleep deprivation is going to take you to multiple places, to multiple comorbidities. So you need to understand that for a blood pressure, heart rate, cardiac output to remain normal, to have a parameters to remain very good, you need a very important sleep balance. And REM sleep also causes arrhythmias. This you need to understand. This is again I added just for your neat purpose. So neat PG la asked question. Arrhythmia causes in the REM sleep, which contribute to increased rate of cardiovascular mortality in early morning. So during your early morning period only your REM starts. And when your REM period is there, when you're going to get arrhythmias, and that is the reason why you see in your environment, in your surrounding, in your social, that people get heart attack more in the early morning. Why? Because of this sleep cycle. This bloody sleep cycle is going to influence every part of your body, and that's where the psychiatry comes into the role. Okay, so your for being a good general medicine physician, for understanding the medicine, you need to understand psychiatry, you need to understand every aspect. So it is not a something that is like very separate, you know. So temporary breathing instability occurs. His sensitivity to PCO2 is going to be declined. Respiratory rate is going to get decreased. All these occurs during your sleep. And finally, my domain. Now, till now, I was talking about the physiological basis. I was talking about the other people, other departments. Now, coming to the emotional regulation, which is very important, isn't it? You guys become now, I think, in a recent years. So, especially after joining here in the past 6 months, when I see patients, I can get a drastic rise in the emotionally unstable people. Why there is a emotionally unstable people? Just think of it. Because of the sleep deprivation. That is the reason why the people go into emotionally unstable. Because for regulating your emotions, your sleep plays a major role. Your sleep affects the situational assessment, attention, emotional appraisal. Sleep is important for appropriate response or cognitive executive functioning of the brain to occur. You need sleep. And sleep deprivation is going to impact this. impact the emotional intelligence of the human, and that leads to increased irritability, experience and negative emotions. Sleep loss is going to result in the tendency towards a catastrophic thinking. ஒரு சூசைட் அட்டம் செய்யறவன் கூட அவனோட ப்ரீவியஸ் ஹிஸ்டரி எடுத்து பார்த்தீங்கன்னா சூசைட் ஹிஸ்டரி செய்யற எல்லாருக்குமே ஒரு ஸ்லீப் அஃபெக்ட் ஆயிருக்கும். ஸோ அப்போ அந்த இடத்துல ஸ்லீப்பை நம்ம கண்ட்ரோல் பண்ண ஆட்டோமேட்டிக்கலி யுவர் catastrophic thinking, your negative thinking, everything get resolved, everything gets better. Okay, so REM sleep in particular is important for emotional memory processing. So you study all night. So during the exams, what we do, guys, basically, we study day and night. We study the entire night. Okay, but do you think the amount you study is matters? Definitely no. Whatever you study, you can put a tick mark that you studied page number 60 to page number 66, page number 60 to page number 70. That's all you can do. But to have that, whatever you read into a memory, into a long-term memory, you need to have a good sleep. Okay, because REM sleep is important for a emotional memory consolidation. REM plays an important role in reducing the emotional intensity of your memory and helps in emotional adaptment. So, ஒரு chronic ஒருத்தருக்கு sleep issue இருக்குன்னா, then they may land up into depression and anxiety. So often when a patient is going to have a mood instability, emotional instability, let them get their sleep back. Let you put something to increase the sleep of the patient. Once that is done for the patient, automatically the mood of the patient gets stable. Okay, so first what you need to do when a patient or when your co-friend, when you're going to see your friend is not sleeping properly, first see the situation and selection. For that situation, modify the situation. Once you modify it, try to bring in attention. And once you bring in attention, you will automatically change your cognitive ability, and that causes appraisal. When there is appraisal, there is going to be a response modulation, and that gives you a better response. So this paper is actually I myself has seen, I have done, and many people tell you, right? So when you want to improve your sleep quality, you need to improve your physical activity. This is something which is most commonly seen, most commonly told. But very surprising thing is when I took a study among medical students specifically, I could see that even though the people are having a less physical activity, okay, less physical activity, okay, the people might have a good sleep quality. How I saw, then I can understand that it is not just the physical activity that is an important role, but your stress is going to play an important role in your sleep quality. That comes to the second topic of mine, sleep. And next, moving to the stress. Before that, this insomnia, I think you particularly Arun mentioned that in the poster. That is the reason why I'm touching it. I'm not going to go in depth about the insomnia, but I'm going to just touch that topic. So insomnia is nothing but it's a common sleep disorder where many clinicians, I'm very sorry, but many clinicians are misdiagnosing it. So they tell if the patient is not sleeping, insomnia. When the patient is not having when the patient tells you I'm not able to sleep, insomnia. It's not insomnia that everyone, if you call insomnia, then me, you, everyone are insomnia. Then how, when you call it as an insomnia, it's not that the patient is sleeping. When the patient is going to have difficulty in initiating sleep, when the patient is having difficulty in maintaining sleep, when the patient is going to have difficulty by causing early morning awakening, when this is there, you call it as insomnia. It is not that you purposefully does not sleep and call yourself as an insomnia, as a Batman. Okay, so insomnia is a short-term insomnia. It can be divided to a short-term and long-term. Short-term, basically, it is going to last just for 3 months. Long-term, it can last for more than 3 months. Okay, this PPT I will share you. I want you guys to go through this. I'm not going to explain you, but this is something that is very important. Short note for your university exam in your final years. So insomnia, once it is asked in university exam in Tamil Nadu MGI University. So I recommend you to go through this one particular flow chart. When you understand the etiology of insomnia, that will be helpful for writing that essay with this thing. But I wanted to talk about this something called as 3P model. What is 3P model? You need to understand this 3P model to analyze yourself whether you are having insomnia, whether you have some sleep disorder. How do you do that? You don't have to diagnose it. You have to understand it and correct it. That's all. Okay. So first thing is predisposing factors. So there are some personalities like perfectionism or an ancastic trait or a cluster C ancastic trait or a obsession trait. These people wants to complete their work, okay, before they want to go into sleep. Like you, me, or there are many people. Arun was telling, right, he wants to read research article. So in order to read research article, he is not sleeping. So those kind of unencastic people, that personality causes him not to sleep. So that comes under first P, predisposing factor. Second thing is a precipitating factor. So you will be sleeping well, but all of the sudden you are final year university exam timetable is out. Third year university exam timetable is out. That pressure makes you to not sleep, and then your life changes. So you may go into a relationship, you may get a breakup, and after breakup you start to weep, and you know you are just ruminating those thoughts, and you are not sleeping. And finally, perpetual factors like your irregular schedule, late night schedule, all these things. So in predisposing, I don't think so you cannot change your personality so easily. But you cannot change your precipitating factors. So factors will come, factors will go. So you need to learn how to cope up these precipitating factors. You need to learn how to cope up these stress and perceptual factors. You can cut it off from your life. And when you're going to do these two things, avoiding this predisposing factors, you will be able to control your sleep. So what can we do now? So now basically you will be asking me, sir, what I can do now, sir? You can regulate your sleep pattern. Sir, how to regulate the sleep pattern? That is exactly what I am not able to do. And that is exactly why I'm attending your session. That's exactly why Games has created this wonderful platform to discuss this topic. So I am here to tell you such small things that you can do to improve your sleep cycle, to improve your circadian rhythm, to improve your insomnia if you guys think you have. So always you have to understand one thing. You need to differentiate between insomnia and depression. Okay. So insomnia is different, depression is different. Okay. So in both the things, you will have a poor concentration. In both the things, you will have irritability, you have low mood. But so because of this, what happens is often instead of depression, instead of a very serious depression where you need treatment, you go into insomnia. You go diagnose it as insomnia. And what you do, you tell, Kanna, please sleep well. But the patient will be having some problem, depression. You don't treat that and you tell him to sleep. How will he sleep? Or you give benzodiazepam and make him to sleep. How will he sleep? So that is where this today, 21st century, most of the sleep disturbance are not treated with Z drugs, not treated with your benzodiazepams. You treat the underlying causes of insomnia. Automatically, your insomnia gets treated. Instead of giving the Z drugs and benzodiazepam, which is going to act. Do you know where it acts? Basically, I showed you a diagram, right? Do you remember that? Do you remember that? So I'll show you once again. So it is going to act over here. Nothing. It is going to act over here and it's going to cause sleep. It is going to increase your GABA and it is going to cause sleep. But that doesn't going to help you in a long run. It is going to become you addictive. So that is why now what happened is now we are moving into antidepressants. The example, your quetiapine. So just remember, guys, you are budding clinicians. Okay. So remember one thing. Don't prescribe alprazolam for your patient for sleep disturbances. Okay. I think left and right people are prescribing alprazolam. One problem is alprazolam improves your sleep. I totally agree to it. But the problem arises, what I am seeing here is this benzodiazepams, Z drugs, are going to act on the GABA receptor. They are going to act on your VLPO and cortical areas. And they are going to act. But what is the problem? They are going to cause something called as addiction. Okay, without your benzodiazepam drugs, you will not be able to sleep in future. You will not be able to sleep in future. So please don't take benzodiazepam just like that for your sleep disturbances. If you have a problem, okay, definitely why you are not sleeping? Because you have some underlying factor. Okay, go into your psychiatry department, psychiatry PGs or psychiatric consultants. And it's not wrong in taking opinion from them, isn't it? They are your faculties, they are your professors, isn't it? So go to them, Tell them what is the underlying factor. Let them decide whether to give Z drugs or whether to give a mild dose of antidepressant. The quetiapine, there is something 25 mg, very, very mild dose. So I will tell you one small thing about quetiapine here, since I don't want to go into the academic part, but this is a wonderful drug. Okay, it has three actions depending on the dose. One is hypnosis and sedative, hypnotic action. One is hypnotic action. Second thing is going to be your anti-psychotic. And you also have antidepressant action. Antidepressant action at a very low dose. For example, 12.5 mg, 25 mg. Your quetiapine is going to act as a sedative and hypnotic. When I'm going to go into 50 mg, 100 mg, it is going to act as antipsychotic. When I'm going to go into 200 mg, 300 mg, it is going to act as antidepressants. So you have such a wonderful drug with you, isn't it? Why don't you use that? Why don't you use that? They are going to act at the VLPO, not at the GABAergic point of view, but it is going to act on the serotonin system, and thus it does not cause any addiction to you. And also, you also use something called as orexin antagonist, isn't it? Like, which is going to inhibit your wake promoting orexin signaling from lateral hypothalamus, and that is going to help you. What are those? Suvorexant, all the Suvorexant, and you have something called as Ramelton. Ramelton is a melatonin, so other inhibit pano. So your Suvorexant, it is going to act. So I will tell you the medicine. So it is your Suvorexant. Okay, this is going to Orex. So can you see here? So this is going to be a orexin antagonist. So orexin antagonist, that is your suvorexant. Okay, so that is going to help you in maintenance of insomnia, basically. So you can use zolpidem and all those things. Like zolpidem is commonly used nowadays because they are Z drugs. It does not have such a effect of your benzodiazepams. So you use zolpidem. Zolpidem is going to be 10 mg you will be giving. Okay, late at night if you're not getting a sleep. Or you can also go for clonazepam. Clonazepam, basically, when you're going to have too much of tension, you will be taking 0.25 mg. All these drugs are there. Okay, now coming towards the therapy. When do you need therapy, guys? When do you need therapy? Okay, so this is the next question that comes into your mind, isn't it? When do I want a therapy? When I am not able to sleep, when I am going to get disturbed. Okay, then only you will go to this therapy. But remember, guys, therapy or the goal வந்து to optimize your sleep duration, to learn the sleep defeating behaviors, and to adapt the sleep promoting behavior, and to achieve a sustained maintaining improvement in the sleep for a long term. But problem is you cannot assure anything. It is not a magical therapy. People think that they come to the psychologist, they don't come to psychiatrists for therapy. This is one misconception I want to tell you. They go to psychologists, but what happens is they think that within 1 or 2 sessions everything gets improved. It never works like that. How does it work? How does it work? Basically, principle of your all your CBT, the principle of all your CBT is okay. It is going to be a dysfunctional belief and attitude about the sleep. You're going to help in identifying what are the negative thoughts. What are the negative thoughts? It's going to help in belief and attitude about the sleep. It helps you to understand. Then it is going to help you to understand the maladaptive habits. What are the habits that help you to that is going to prevent you from going into sleep? For example, electronic devices during going to your bedside. And then emotional, physiological, and your cognitive arousal. So that is going to be like concentrated. And finally, consequence of insomnia, fear of its effect are also going to be addressed. Only when you address all these things, then only it is going to help you. Now you need to understand. Now, can you tell me, guys? Can you just put a score for it? Okay, out of 1, 2. Now you're going to calculate the score and tell me. Now you guys are going to calculate the score and tell me, guys. Come on, you're going to do this in now, right now, you're going to do this and you're going to tell me. So I sometimes, so 0 for none. Okay, 0 is for none. Okay, 1 means sometimes. Okay, when you're going to put 2 score, often or always. So now you put score for this and tell me. I'll also put my score also, basically. I go to sleep and wake up roughly at same time every day. Okay, never happens. I avoid using phones, laptop at least 1 hour before. Never. I avoid caffeine after 2 to 4 p.m. It is also not happening. Okay, my bedroom is dark, quiet, and cool when I go to sleep. This at least I will accept. I avoid studying or working in the bed. Sometimes. I use bed only for sleep and intimacy, not for entertainment and multitasking. So I can tell sometimes. I avoid heavy meals or jaggery, sugary snacks before going to the bedtime. Sometimes. I avoid alcohol or nicotine close to bedtime. Yes, of course. I give myself time to wind down or meditate something. I never does that because I don't have time. I get exposed to natural light during morning or daytime. Yes, of course, every day I do. For me, the score is 2, 4, 5, 6, 7, 8, 9. So can you tell me what is your scores? Can you guys put in the chat box what is your scores? Come on, come on, come on, come on. This is going to give you an insight. For you also 9, Lalita. Okay, fine. Others, I'll tell you what it means. When everyone are going to put, I'll tell you what is your sleep hygiene is. I'm going to tell you what is your sleep hygiene is. 10, very good. D. Rudrani has 10. Others. I want all the 32, 34 people to come on, put in the group, put in the chat box. This is going to give you an insight. Basically, we tell in psychiatry, my HOD tells always, when a patient has insight, then he is going to improve. Same way, when you guys have insight, you're going to improve today. So you're going to put in the chat box. Where is Arunagiri went? Arunagiri, what is your score? Yasura 10, very good. Shravya 9, Arun 6, very poor. Very poor. Okay. Others, Sanjay Kumar 9. Come on, come on. Others, others. Okay. So self introspect yourself now. Okay. Very less than 10, whoever got, including me, we guys have very poor sleep quality. Very poor sleep quality. We guys have very poor sleep quality. Okay. Okay. So 10 to 15, if someone got, you need some improvement. If you are going to have more than 15, then you are the one who have excellent sleep hygiene. Excellent sleep hygiene. But I am sure that none of the medical students will have this. Okay, that's exactly the situation where we are struck with. So this is something that is given as a sleep hygiene. Maintain regular hours of bedtime and light snacks taking. If you are hungry, you need to, these things you can just take a screenshot and put up a poster in your bedrooms. So this is the thing which you need to follow, but no one is following right now. And I think at the end of the session you will know how to follow it. So finally, what can we do now? What can we do now? We can do nothing but to follow sleep cycle. Okay, follow the sleep hygiene, introspect yourself, follow sleep hygiene, introspect yourself, introspect yourself, and that is something that is going to help you. Finally, I'm going to move towards something called as stress. This stress is something that is affecting our sleep, isn't it? All time we are talking about the one that is affecting our sleep cycle. But what is affecting our sleep cycle? The stress levels are the one that is affecting our sleep cycle, isn't it? So do we not, shouldn't we talk about that stress? Shouldn't we consider, shouldn't we think about that stress which is actually causing a disruption in the sleep cycle? So now let's just briefly talk about the second triad, that is your stress, academic stress. Stress is a physiological and a psychological response to perceive a challenge. When a student perceives an upcoming exam or assignment deadline, this our brain is going to activate something called as hypothalamic pituitary adrenal axis, and there is an adrenaline surge to us. In a short term, the cortisol is going to get increased, it's going to get accumulated, and they are going to enhance our alertness, enhance our focus. This is something called as Yerkes Dodson law. Yerkes Dodson law. Okay, which is going to give you a moderate stress and increase your performance. But when this is going to be chronically present, it is going to be toxic to your brain, like a toxic relationship. This is going to be a toxic towards your brain. So relationships are good, isn't it? That's why we fall into relationship. But when it is going to become toxic, we need to throw it away. Same way, prolonged cortisol exposure is going to impair your hippocampus, which is a very important for your memory formation. It is going to be reduced. This cortisol is also going to reduce your prefrontal cortex functioning, which is going to be important for judgment. You sit in a MCQ exam. Out of four, you need to rule out three and select one. For that, you need a prefrontal cortex. And when you are going to have increased stress, what happens? Your prefrontal cortex function is going to be affected. Same way, your amygdala becomes hyperactive and students becomes more emotional, more anxious. That is the reason why students takes decisions at the emotional ability, emotional aspects. The brain, when it comes under a chronic stress, especially essentially becomes a less efficient and more reactive, like a machine, poorly suited for the demands of medical education. What's worse is that stress directly affects your sleep. High stress is going to lead to a cognitive hyperarousal. Racing thoughts is going to come. Overthinking is going to be present at the bedtime and finally lead to your insomnia. And sleep deprivation in turn is going to make a student less resilient to stress and it becomes a viscous cycle. Study shows that students under academic stress sleep few hours, report more fragmented sleep, and have poorer subjective sleep quality. High stress students also reports more somatic symptoms, like suddenly people start to have headache, suddenly or a stomach ache, suddenly people have muscle tension. One point you need to carry here is not all stresses are visible. You think that you are not stressed. High achieving students may function well outwardly but suffer internally. They may lead to or perfectionism or self doubt always gets into their thoughts even though they look like stress free. As a future doctor, you need to understand this neurobiology of stress, which is essential not just for your patients, guys, but it is for your own well being. So, here, a self reflection question. Can you all recall a time when you are so stressed that you couldn't sleep and think clearly? Everyone, do you have that kind of situation? Have you ever felt that kind of situation, guys? Everyone, is there any one student here who feels that no for this question? Who thinks that the answer is no for this question? Every one of you will have yes for this question because your HPA axis gets hijacking your executive functions. So stress is not just a reaction to pressure. It is a biological event that shapes how your brain learns, how your brain remembers, and how it is going to regulate your emotion. So now let's talk the solution. Now I talked all those things. Now what is going to be my solution? What I'm going to take home? I'm going to take home few points, guys, today. First thing, you're going to make a consistent wake up time even on weekends. Make sure that you wake up at the right time, you sleep at the right time. Schedule yourself. Avoid caffeine after 2 to 4 p.m. If the half life of your caffeine is going to be extending till your evening or late night, so when it is going to be present after your late night, it is going to extend your wakefulness long into the night. Turn off your screen at least 30 to 60 minutes before bedtime. Especially why? What happens? What happens to blue light? When the blue light is there, what happens? Can you guys put in the chat box? When there is a blue light, what happens? What is going to get released? When the blue light is going to be there, till today, till now, I am talking so much of things. What you need to remember, when the blue light is there, scientifically, you need to tell to your cousin, you need to tell to your friends. When the blue light is going to be more, what happens? What increases in your body? Melatonin, excellent. So melatonin is going to be released. So reserve your bed only for sleep, not for studying, not for watching videos, not for scrolling your Instagram, not for watching series. Create a wind down routine, dim light, relaxing activity, consistent rituals. All this are going to signal your brain to go to sleep. So make sure that you have a dim light. You go for a relaxing activity and you are consistent in it. Optimize your sleep environment. Cool, dark, quiet, comfortable. And avoid heavy meals, alcohol, nicotine close to your bedtime. And get morning sunlight exposure to anchor your circadian rhythm. And don't lie in the bed awake. If you can't sleep more than 20 minutes, do something relaxing, then get back to the sleep. Most student knows this tips. இதெல்லாம் புதுசா உங்களுக்குலாம் கண்டிப்பா இல்ல. எல்லாருக்குமே தெரியும். Few of them would have applied it, some of the points, and some of them would be consistent. Only people who are consistent may get above 15, 20 your scores. That's why brief intervention fail without structured behavioral changes. That's why CBT comes into role, cognitive behavior therapy. When you're going to try all these things, when it is not going to work out, go to your psychologist or psychiatrist in your department, in your college. They can help you out to control your stimulus, to stimulate your, to restrict your sleep and to cognitively restructure yourself and to prevent the relapse. Okay. Okay. Can you understand? This is exactly what I want to tell. Which are the two habits which are hardest for you to conclude? Which are the two habits which you feel hardest for you to change? I have told you 14 points, isn't it? I told you around 14 points. Out of this 14 points, which are the two you think that it is very hard to do, hard to follow? Can you put in the chat box? Can I put in the chat box? Last and final question. No screen time before going to bed. It is very hard. Exactly, Shravya. I accept it. Others. Others, come on, guys. Come on, come on, come on. Others. What are the other habits you think? What are the other habits you think? It is very hard. Everyone tells it as screen time. Everyone. So today what you're going to do is I have structured. So my thesis topic is also same. How to control screen time. I tell everyone to control screen time. But is it possible? You are using 3 hours, 4 hours before your sleep. And I tell you to stop all of a sudden. Will you be able to stop? That is why we need to structure it. Okay. We need to structure it. We need to structure such that, okay, we are going to reduce our screen time, not all of the sudden. We are going to substitute it by reading some book, modify it. Okay. Read, do something else and slowly, slowly, slowly get away from the screen time. It's very hard, guys, but try to replace it. Try to replace it. Okay, so that's exactly what there are some papers where it tells you to coping up strategies, how we are going to cope up. So 5 skills you need to understand both stress management as well as your sleep restructuring. One, you need to self observe, you need to self introspect, then cognitively reconstruct. Cognitive reconstruction is understand the emotional intelligence, understand your occupational intelligence. Intelligence-ல நம்ம changes கொண்டு வரணும். Then relaxation training, time management and problem solving. Okay, why to get therapy? Why should I get therapy? Because you should be able to anticipate your problems and solve them and make a plan to avoid them. And they cope up with setback. So ஒரு தனியா நம்ம என்னதான் நினைச்சாலும் ஒரு தெரப்பி இல்லாம நம்மளால நம்ம ஒரு கோப் அப் பண்றது ரொம்ப கஷ்டம். If you are able to cope up, well and good. But if you are not able to cope up, go to a therapy. Therapy will definitely help you. So take home points is stress and sleep cognition are interlinked. Students are very prone for the circadian misalignment and insomnia because of the worst system which is prevailing in our country. Sleep hygiene and the stress reduction are essential skills which every future doctor should have, because you guys are going to teach your patients. If you yourself doesn't know, how you're going to teach your patient? And recognizing insomnia is very important to differentiate it between the depression and insomnia, because it can prevent the psychiatric comorbidities. So protect your sleep like you want to protect your grades. If you want to protect your grades, you want to protect your sleep. Okay, so what is one change you wanted to bring in today to manage your stress, manage your sleep? I think everyone will tell stress management, sleep management, ரெண்டுத்துக்குமே screen time குறைக்கணும்னு சொல்வீங்க. Try to do that. So try to fight this stress and regulate the sleep for better functioning of your brain. Are you guys ready? Are you guys ready? If you guys are ready, I'll give you a bonus. Okay, this one thing you're going to follow from today. This one thing you're going to follow from today. Arun, I will send you this table. Send it to all in the group. Let them start writing. Let them introspect themselves, and that is
Sure,
going to
sure.
change them. Okay. So thank you so much, Arun. Thank you so much, the entire team of games, for giving me this wonderful opportunity. I think I made some justice to the people, those who are attending it today. And I think I'm not sure I'm eligible to talk about this as a resident, because I myself is not following any of these points given in this. But unfortunately, as psychiatric resident, I am advising you guys to follow it and giving therapy for you guys. Hope that I follow in future all these points at some point of time after completing my residency. With this note, thank you all once again for giving me this opportunity.
Thank you.
You're not
Thank you
audible.
so much.
You're not audible.
Uh,
Dr. Arunagiri, you're not
it's a
audible.
great session. It's a very informative content as well as some need. Now I really understood like this session is perfectly curated for me. Invitation I have done such a great session. It's truly a special moment for me to invite you. And you are the one who motivated. Kekirana? Am I audible?
You suddenly you became very fast like a Manning patient, Ra. Okay. I think you have some internet issues. You can switch off your camera and speak. I think that will help you out.
Oh, if am yeah, yeah, I guess. Am I audible now?
Yeah, you're audible now. Thank you, guys. Thank you so much for your wonderful comments. Thank you all. Yeah, Arun, now you're audible. Okay, guys, I think Arun is having some technical issues. So
Oh
thank
my
you so much for
Hello,
inviting me.
hello, hello.
Yes, yes, you're audible.
Yeah. Thank you so much, Anna. And it's such a great moment for me. Like you are the one who motivated me when I'm in the second year, and because of your motivation, whoever I am now right now, and I'm just using this stage to thank you once again, Anna. And thank you for my invitation to have this great session in your hectic schedule as well. And I really want to thank my team Lalita and Hariram, and for everyone who have participated for this session. And once again, thank you so much for everyone. And thank you so much, Anna.
Thank you, thank you, thank you.
Thank you so much. Thank you so much. Everyone, kindly fill the G form in the chat box. Lalita, could you please share it?
Yeah, sure. Did sir please check once?
Thank you so much, everyone. And we have shared the Google Form link in webinar group, and you can fill it, and we will issue the certificate. Okay. Thank you so much, guys. You can leave now.